Relax with your arms at your side.
After the patient empties her bladder, have her lie supine with her arms at her sides. Working from the patient's right side, use a tangential light and begin by inspecting the abdomen at eye level. Note the skin color, which should be consistent with the rest of the body or somewhat paler. Also observe surface characteristics. You should see no pronounced venous patterns or lesions, but may note scars or striae. If you find an abnormality, locate it within 4 quadrants. Just mentally divide the abdomen with 2 lines that intersect at the umbilicus and form the right upper, right lower, and left lower quadrants. Or map the finding within 9 regions. Here, 2 horizontal lines cross the lowest edge of the costal margin and the edge of the iliac crest, and 2 vertical lines run from the midclavicular line to the middle of the poupart ligament on each side. Be sure to use one mapping method consistently. Next, inspect the contour of the abdomen, which may be flat, rounded, or scaphoid in an adult. In a young child, a rounded or convex contour is most common. Also inspect the umbilicus. It should be centrally located and may be inverted or slightly protruded. Now check for symmetry while standing behind the patient's head. The abdomen should be symmetric, with no distension or bulges. To bring out any hidden abnormalities, use 2 simple maneuvers.
Take a deep breath and hold it. Good. Now lift your head off the table and breathe normally.
You should see no bulges, masses, or muscle separation.
Okay, good. Relax.
Also observe for abdominal movement, which should appear smooth and occur with respiration. There should be no marked pulsation in the upper midline or surface motion from peristalsis. Although auscultation doesn't usually follow inspection, in an abdominal examination it does.
I'm going to listen to your abdomen. Just relax. Breathe normally.
Otherwise, percussion and palpation can alter the frequency and intensity of bowel sounds. So with the diaphragm of a warmed stethoscope, auscultate the patient's bowel sounds. These generalized clicks and gurgles reflect peristalsis and should occur irregularly 5 to 35 times per minute. Also listen for vascular sounds, such as friction rubs over the liver and spleen. These high-pitched sounds should not occur. Now switch to the bell and auscultate the epigastric area and umbilicus. In both locations, there should be no venous hum. Also use the bell to auscultate the aorta, renal arteries, iliac arteries, and femoral arteries. Over the vessels, you should hear no bruits. Next, percuss all of the quadrants or regions, following a systematic route such as this one. As you percuss, expect to hear tympany over air-filled organs, such as the stomach or intestines. In an older patient, tympany may be louder and more extensive, because aging decreases intestinal motility, which can cause gas to accumulate. Dullness may be heard over solid organs, such as the liver, a distended bladder, or a mass.
I'm going to tap your abdomen again to check the size of your liver.
Next, use percussion to assess the liver span. Starting from a tympanic area, percuss up the right midclavicular line until the sound changes to dullness. Mark this point as the liver's lower border, which usually is at or just below the costal margin. Then percuss from an area of lung resonance down the right midclavicular line until the sound changes to dullness. Mark this spot as the liver's upper border, which typically falls between the 5th and 7th intercostal spaces. Then measure the distance between the marks. The liver span usually is 6 to 12 centimeters. In an older adult, the liver span may be slightly smaller and shifted down by 1 to 2 centimeters.
Now I'm going to tap.
Next, percuss over the left lower anterior rib cage, in the left epigastric region, and over the spleen while the patient takes a deep breath. The gastric air bubble should cause tympany that's lower pitched than intestinal tympany.
I'm going to lightly press on your abdomen. Let me know if it hurts anywhere.
I will.
Next, lightly palpate in all quadrants systematically, but assess any painful or tender areas last. Using the palmar surface of your fingers, depress the abdominal wall no more than 1 centimeter. The abdomen should feel smooth and soft, and palpation should cause no discomfort, pain, or tenderness.
This area seems a little tense. Let me see if I can relax it.
If you feel muscle resistance, determine its source.
Bend your knees slightly so I can put the pillow under. Now, take a deep, slow breath. Relax. And just slowly breathe in and out.
With voluntary resistance, the abdominal muscles relax during exhalation.
Good.
With involuntary resistance, muscle tension remains.
You're ticklish, aren't you? Let's try this. I'm going to put your hand in my hand and we're going to feel together.
For a child or anyone who is ticklish, palpate with a firm touch. If that doesn't help, place the child's hand under your hand, leaving your fingers free to palpate.
I'm going to press a little deeper now.
To continue, palpate with moderate pressure in all 4 quadrants, using the same hand position as for light palpation. The patient may report tenderness that wasn't present during light palpation.
Now, take slow, deep breaths.
Also, palpate with the side of your hand over the liver and spleen. These organs should bump into your hand during inspiration. Next, palpate deeply and evenly in all 4 quadrants.
Let me know if it hurts anywhere.
Using one hand or a bimanual technique, move your fingers back and forth over the abdominal contents. In a healthy patient, deep palpation should detect no masses, but may cause tenderness over the cecum, sigmoid colon, aorta, and xiphoid process.
It's a little tender there.
If you find a mass, document its characteristics, including its location, size, shape, consistency, tenderness, pulsation, mobility, and movement with respiration. Now palpate the umbilical ring and surrounding area. The umbilical ring should be round and regular, and the area should be free of bulges and masses. Next, palpate specific structures.
I'm going to examine your liver.
Put your left hand under the 11th and 12th ribs and press up. Then put your right hand on the right midclavicular line below the level of liver dullness. Point your fingers toward the patient's head and press gently in and up.
Now, take a deep breath and hold it while I feel for the edge of your liver.
Okay.
If palpable, the liver should be firm, smooth, even, and non-tender. As an alternative, you may face the patient's feet and hook your fingers over her right costal margin. While she takes a deep breath, press in and up and feel for the liver edge, which should descend to meet your fingers.
Now I'm going to reach across and feel for your spleen.
With your left hand pressing up against the left costovertebral angle, place your right fingertips below the left costal margin.
Take a deep breath and hold it.
As the patient inhales, press your fingertips in toward the spleen, which usually is not palpable.
I'm going to see if I can feel for your kidneys now. I'm going to start with the right one.
Place one hand under the patient's right flank and the other hand at her right costal margin.
Take a deep breath.
At the height of inspiration, press the fingers of both hands together to try to capture the kidney.
And exhale and hold.
Slowly release the pressure and feel for the kidney to slide between your fingers. It may not be palpable. Also try to capture the left kidney. Compared to the right kidney, the left one is less likely to be palpable.
Take a deep breath.
But if the kidneys are palpable, they should be smooth, firm, and non-tender.
I'm going to feel for your aorta now.
On one side, press the palmar surface of your fingers deeply in toward the aorta. On the other side, press in with your thumb or the fingers of your other hand. If palpable, the aorta should pulsate in an anterior direction.
While I have you lying down, I'm going to check your abdominal reflexes.
Using the handle of a reflex hammer, stroke the upper quadrants up and away from the umbilicus, and stroke the lower quadrants down and away. With each stroke, the abdominal muscles should contract, and the umbilicus should pull toward the stroked side.
Lastly, I need to tap over your kidneys.
With the patient seated, put your palm over her left costovertebral angle and strike it with your other hand, using the ulnar surface of your fist.
Like a dull thud. It didn't hurt.
Repeat this fist percussion over the left costovertebral angle. It should cause no tenderness or pain. With so many organs and structures housed in the abdomen, you need sharp history-taking and examination skills to assess your patient's abdomen accurately. Together with the patient's test results, your examination findings can help guide your patient's care as effectively as possible.